Our group is focused on Xarelto as a cardiovascular drug, providing benefit in patients across 6 indications in the United States. One of the focuses that we've had has been on stroke, and stroke is a devastating complication in patients with non-valvular atrial fibrillation. 1 in 3 patients actually with atrial fibrillation can develop stroke in their lifetime. And it's a preventable complication. Anticoagulants are a mainstay of treatment for physicians to use for their patients with non-valvular atrial fibrillation to prevent stroke. One of the key issues is how do these medications perform in real-world practice. There are clinical trials that led to the approval of these agents, but really it's very important to understand the efficacy and safety of these medicines in real-world practice. At Janssen, we've been committed, absolutely committed, to studying our medicine, Xarelto, which is approved to reduce the risk of stroke in patients with non-valvular AF. We're absolutely committed to studying our drug in real-world practice. In fact, over 91,000 patients have been evaluated in real-world studies across the 6 indications that are approved in the United States. And we were very encouraged that study after study have shown that the positive benefit-risk profile of Xarelto has been confirmed in real-world data. So I think there's an opportunity to learn new things about the drug when it's used, but I think it's also important because clinical trials enroll certain patients based on the inclusion-exclusion criteria. So they are really important to study the efficacy and safety of the drug that supports regulatory approval of the drugs. But when you're out in the real world, you don't have those exclusion criteria. Physicians have to evaluate their patients, for example, with non-valvular AF. They have to think about their risk, the CHA2DS2-VASc score. Are they at high risk for ischemic stroke? How can I reduce their stroke at the same time avoiding the bleeding complications that are associated really with any anticoagulant? All the novel anticoagulants have been approved in non-valvular atrial fibrillation. The risk of a stroke in a patient with non-valvular atrial fibrillation is about 5-fold higher than patients without non-valvular atrial fibrillation. There are also other types of atrial fibrillation that are associated, for example, with a mechanical valve. Patients with mechanical valves are treated with warfarin. The anticoagulation parameters that are important to regulate in those patients are actually different than in non-valvular atrial fibrillation. None of the NOACs have been approved for mechanical valves. Studies are ongoing. In fact, at Janssen, we're committed to evaluating Xarelto for unmet medical needs. Blood clots underlie many cardiovascular diseases, and in fact in the Explorer program we are looking at other cardiovascular conditions and there actually is one trial called Galileo, which is actually looking at patients with TAVR, trans-aortic valve replacement, and that is a bioprosthesis that's put in through a catheter. So that trial is actually has begun. The Explorer program is the overall umbrella program, the clinical development program for Xarelto. And we're evaluating Xarelto versus either standard of care for those new conditions. We're examining the effects of Xarelto in patients with acute coronary syndromes, in patients with heart failure, in patients with coronary artery disease, stroke of unknown origin, or unknown source, cancer, and medically ill, just to name a few of those. Actually the program is set up to evaluate Xarelto to see whether to determine its efficacy and safety that may drive potentially new indications for the drug. It's hard, obviously, to predict the future. I think warfarin's been around for a long time. I think what we're seeing, though, in some of the clinical trials, for example, with Xarelto, where there's a reduction in fatal bleeding, where there's a reduction in, when one compares Xarelto to warfarin for intracranial hemorrhage, which is really the most life-threatening type of bleed. And in fact, across all the NOAC class, there was a significant reduction in intracranial hemorrhage when the NOACs were compared to warfarin in clinical trials. The care has to be individualized. Physicians individualize the care for every patient, and there may be different issues for different patients. I think Xarelto provides a once-daily medication, for example, to reduce the risk of stroke in patients with non-valvular atrial fibrillation. There are advantages of Xarelto with respect to not requiring blood monitoring, not requiring watching the diet with respect to the vitamin K antagonists like warfarin. So I think there are the doctor has to weigh different conditions, different aspects of patients' demographic information to decide what the best medicine. So I don't think there's actually a cookbook. I can't give you a recipe for each individual patient, but I think Xarelto provides a really good option for physicians to consider for their patients. I think we continue in our studies, real-world studies of Xarelto, where, as I said, 91,000 patients are being evaluated. Over 91,000 patients have been evaluated in real-world safety. So we continually to be committed to provide evidence to physicians about the real-world safety and efficacy performance of our drug. In addition, as I mentioned, the Explorer research program. By the time it completes, there'll be over 275,000 patients enrolled, and that includes clinical development programs for potentially new conditions. That includes independent registries and non-intervention studies. So we're absolutely committed to providing the most important data for physicians to use now to incorporate into that evidence about the real-world performance of the drug, as well as examining these potentially new uses for the medications in rigorous clinical trials.